All right, welcome to The Explainer. Today we're going to pull back the curtain on the hidden system that makes sure the medicine you take is actually safe. It's a really complex journey, guarded by a whole team of invisible protectors, and we're about to follow their every move.
I mean, really think about it. That prescription in your hand is so much more than just a piece of paper from your doctor. It's the finish line of this incredibly guarded journey, kind of like a relay race with all these critical checkpoints designed for one single purpose: to protect you.
So we're going to follow that journey through 4 key checkpoints. Each one is managed by a different federal agency, and when you put them all together, they form this invisible system of safety. So let's start at the very beginning. Our journey starts way before a drug is even produced. This is the first, and you could argue the most important checkpoint, and it's run by the FDA. They are the ultimate gatekeeper. The FDA's mission is crystal clear: protect the public. And they do this by rigorously testing and evaluating every new drug. If a medicine isn't proven to be both safe and effective, the FDA just won't let it on the market. Simple as that. They basically hold the keys to the entire pharmaceutical kingdom.
But the FDA's job doesn't just stop once a drug gets approved. Oh no, they are constantly policing 2 major violations. The first is misbranding. Is the label lying or giving you the wrong directions? And the second is adulteration. Is the pill itself pure and made in a clean facility? It all boils down to one absolutely crucial guarantee: what's on the bottle has to match what's in the bottle.
And their oversight gets even more specific, right down to the pharmacy level. The FDA draws this hard line between what they call a 503A pharmacy, that's your traditional spot that might custom mix a drug for one specific patient, and a 503B facility, which is basically a factory pumping out huge batches. And that's a really critical distinction, because a mistake on a small scale is totally different from a mistake on a massive one.
So, a drug has made it past the FDA's tests. But for certain medicines, the ones with a risk of abuse, the journey hits a brand new checkpoint with much, much tighter security, and this one is managed by the DEA.
The DEA has this tricky dual role. They're the guardians against the misuse and illegal trafficking of these controlled substances, but they also have to make sure that patients who legitimately need these medications can still get them. It's a really delicate balancing act. Now, to manage that balance, the DEA classifies drugs into 5 schedules based on their potential for abuse. Schedule 1 drugs, like heroin, have no accepted medical use. But check out Schedule 2. It has a high potential for abuse, yet it includes really important medications like oxycodone and Adderall. This simple schedule number determines everything: how a prescription has to be written, how it's stored, even how many refills you're allowed to get.
And to enforce all these rules, the DEA demands a perfect paper trail. Pharmacies are required to keep meticulous records on all controlled substances for a minimum of 2 years. Why? Well, because a DEA agent could walk in for a surprise audit at any time, and those records better be ready to go.
The pharmacy itself is also under heavy scrutiny. It has to be registered with the DEA, and that registration has to be renewed every 3 years. And if any of these controlled substances are stolen or just go missing, it has to be reported immediately. No delays, no excuses.
Okay, so the prescription is verified. The controlled substance rules are all met. Now, as the pharmacist prepares to fill it, a completely different kind of protector steps in. And this one isn't concerned with the pill itself, but with your personal information.
This is where the Department of Health and Human Services, or HHS, deploys its primary shield, HIPAA. I'm sure you've signed HIPAA forms at the doctor's office. It's the big federal law that basically creates a cone of silence around all your medical records.
So, what does this actually mean in practice? It means your diagnosis, your prescriptions, your entire medical history, all of that is considered protected health information, or PHI, and your pharmacy is legally forbidden from sharing it with almost anyone without your explicit permission. They are the guardians of your privacy.
And this law has some serious teeth. If a pharmacy ever has a data breach and your private information gets exposed, they are on a very strict deadline. They have to notify you and anyone else affected within 60 days of discovering that breach.
Okay, the pill is now in the bottle, the records are all straight, and your privacy is protected. But before that bottle is actually handed to you, there is one final lock to ensure safety, not in the pharmacy, but in your home.
Come on, we've all been there, right? Struggling with one of those push-and-turn caps. So why are they designed to be so frustrating? Well, the answer lies with our 4th and final agency, the Consumer Product Safety Commission, or CPSC.
That cap is a direct result of the Poison Prevention Packaging Act. Its purpose is simple and absolutely vital: to prevent accidental poisonings in young children. And the design is actually a pretty specific engineering challenge. It has to be difficult enough to stop over 80% of kids under 5, but still be accessible enough for senior adults to open.
So what this whole journey shows us is that these 4 agencies aren't just working in isolation. They form a single, interconnected system of protection, one that follows your medicine from the lab all the way to your cabinet.
So just to recap, you have the FDA as the gatekeeper, making sure the drug is pure and effective. The DEA as the guardian, securing it from abuse. HHS as the shield, protecting your private data. And the CPSC as the final lock, protecting your family at home. Each one plays a crucial, non-negotiable role in your prescription-safe journey.
The system we have is robust, no doubt. It's been built over decades to address all the risks we know about. But as medicine evolves with things like personalized drugs, gene therapies, new digital health tools, it really leaves us with a final thought. What is the next great challenge these protectors will have to face?